First, two of our police forces are looking at allowing a private firm to run their control room operations. Nottinghamshire and Leicestershire are investigating the idea of G4S running operations like emergency call handling. Another of our forces, Lincolnshire, has already gone down that route. It was the first to let G4S take over many of its functions, including its control room. And it says it's saved millions of pounds as a result. And joining us to discuss this is Paddy Tipping, the Police and Crime Commissioner for Nottinghamshire. I'll come to you in just a moment, Paddy. But first, Pauline, what is your take on this? Is it a good way of saving money?
If it does save money, yes, it is, because it'll keep more police out there in front of the public and doing their job. And if we can reduce the bureaucracy for police officers and stop them having to be in a call centre, it's got to be a good idea.
Can you not understand that some people are worried about this, though?
Well, it doesn't mean save the same people, because a lot of it is civilianised anyway, so it doesn't mean that some of the same people won't be employed. I think we have to look at every single way we can to reduce the costs of running the police service. If that means we reduce the back office functions, but actually keep more police out there, that's what we need to do.
Well, Cecile, the Derbyshire Police and Crime Commissioner has told us that it won't happen in Derbyshire while he's the PCC, but is he missing a trick here?
I'm not quite sure, because I don't know whether I see this as perhaps quasi-privatisation of our police force, and I really do feel that there is the risk of those that are doing the so-called back office jobs are integral to an integrated police force, and I worry by bringing in a private entity there might be risk in relation to people's information going astray. I mean, we do know very much about private companies and the laxed approach that they have taken towards securing information on individual members of our community.
Okay, well, that's something we have to make sure that they don't do, because they have to be secure. They've got to keep things confidential, and we have to write that into their contract. It's not beyond the wit of men to do that.
Paddy, Cecile is voicing some of the concerns that the public will have on this. Nottinghamshire and Leicestershire police forces, though, have told us that they're only looking at the idea of this. So where are we at with this? What's the latest?
Well, the story is this. The Police and Crime Commissioner in Northamptonshire wants to come off their site by the middle of next year. He needs to relocate his control room. He's asked G4S to do a piece of work on it. As we work closely with Northamptonshire, we said, well, we ought to look at all three control rooms. So it's a feasibility.
Makes sense to do that, but will it happen here in the East Midlands?
No, it won't happen here. Let me say that quite definitively, because unlike Pauline, I don't think this is a back office function. It's a door into public services. It's where the police listen to people. It's where the police actually resolve a lot of issues. So I'm very hesitant. I'm very cautious about it.
Well, you've just said it won't happen at all. You're quite confident it won't.
Well, I will take a great deal of persuading, because I think that the control room is part of the police service, essential part of the police service. They talk to the police. It can't be privatised.
But is it your decision at the end of the day, or is it the Chief Constable's decision? Because they've said that they're going to look at this and then they will make their decision. So does it matter what you think, whether you're against it or for it?
On this occasion, the Chief Constable and I are in accord. We both have...
In Nottinghamshire?
In Nottinghamshire, but this is a decision that will be taken in Nottinghamshire about the Nottinghamshire control room. He has real reservations too. Why are we doing it? We're doing it because a colleague in Northamptonshire has some difficulties, has asked us to look at it.
But it is just being looked at?
It's a feasibility study to look at what might be possible.
And in Nottinghamshire it won't happen? I'm
pretty confident it's not going to happen in Nottinghamshire, and I'm pleased to be clear about it.
What do you think about that, Pauline? Well, I mean, this is news to us, isn't it? That it's definitely not going to happen here, according to Paddy.
If you've already made your mind up, what is the point in wasting money on a feasibility study?
That's a fair point, isn't it?
We should look at everything. We should look at every single aspect of the police service and then make a decision, not predetermine it before you've even got the results of the discussion.
What is the point in it then?
Well, I'm not spending any money on it.
No, Northamptonshire are.
Northamptonshire are sovereign in their own kingdom. They're spending £50,000 on this.
Which is a lot of money.
I was asked to contribute, and you know what? I said no, because it's not going to happen in Nottinghamshire.
Well, that's predetermining any sort of look at saving money, and most organisations in this country are having to look at that. Having said that, there's been a review of the spending, and I'm very pleased to see that Derbyshire should not be affected, because they've always been so underfunded before that it's about time they were given more money, and that's happening this time.
Cecile, isn't it right that these police forces look at this issue, because at the end of the day they're going to have to make more cuts?
I think we need to look at the impact of a possible fragmentation of the police force. I agree entirely with Paddy that you can't separate different elements and entities of the police force, that it's all integrated. It should all be integrated in order to ensure that we provide an effective service that the public can be confident in.
But you heard what's happened in Lincolnshire, where they have brought in G4S to run their control room there, and they've actually saved money, and that's also meant they haven't had to cut police officers' jobs.
On the beat. Yeah.
But there's merit in that, surely.
Well, we don't know what the outcome has. That been evaluated, the effectiveness,
well, that's come from Lincolnshire,
efficacy
Lincolnshire Police Force.
Of bringing in a private entity to actually run
Well, it saved them money and meant they haven't had to cut more police officers, is what they've told us.
But do we know whether the outcome of that has been positive all round in terms of providing an integrated police force within that locality?
It's different, but it doesn't mean to say it's not working. And it obviously is working for them, because they're keeping the police force there. They're keeping the numbers of officers who are fighting crime. That's got to be a good thing.
Well, Lincolnshire have reduced their officers, as of all police forces.
That's not what Lincolnshire has said.
Well, I'm sorry, they must have told me the wrong thing.
Well, they have told us that they haven't had to cut police officers because of bringing in this system to run their control officers.
Police officers. They face a difficult financial situation into the future. Pauline rightly says, examine your back office costs. We haven't got a back office. We share our back office with Northamptonshire. We're going to share it with Leicestershire. Ultimately, we're going to have to make some tough decisions when the comprehensive spending review is announced in 3 weeks' time, and inevitably, because we're being asked to save 25 or 40%, all police forces, including Lincolnshire, will lose officers.
But you're ruling this out as a way of saving money, even though Lincolnshire say it has helped them.
I think that our control room is an integral part of frontline services. Nobody advocates privatising frontline services. The control room's part of it. We're not going to do it.
Paddy Tipping, thank you very much indeed. Now, mental health is high on the political agenda right now, with campaigners calling for spending to match funding for people with physical health problems. Local campaigners say they need to overcome the stigma of mental health and intervene early, which would save the NHS millions of pounds. And there are concerns that people from black and ethnic minority communities are more likely to be affected by mental health illnesses. Our political editor, Tony Rowe, reports.
Chris Sim from Nottingham is doing well. He's gone from depression and not being able to look anyone in the eye to become confident and engaging.
If it hadn't been for the help I've got, particularly from Framework and Nature in Mind, I wouldn't be here. I'd either be dead, or I'd be in a hospital, be in prison. I'd be in an institution of some type, I think, because I'd have just sunk deeper and deeper.
He has had so much more than medication after a courageous first visit to a GP. He's had support early on from those expert in finding the right way to help. His was getting out, appreciating nature, but that support is under threat.
80% of people that Framework work with have a mental health issue, so and I think the changes in society generally in terms of cuts and austerity having a much more disproportionate impact on people with mental health problems.
Mental health issues can affect anyone. There's been a 20% increase in cases over the past 5 years. It's constantly being mentioned at Westminster, usually accompanied by the word crisis.
It's not an issue which can be ignored, especially in the black and minority ethnic communities.
People will say that the African Caribbean people are very hard to engage with, or hard to reach, as they say. We're not hard to reach. We may be harder to engage with, but I would go as far as say that we're easy to ignore.
Leicestershire's Chief Constable said this week officers are having to increasingly deal with mental health issues rather than crime. For politicians who've promised extra funds, there's a challenge.
Let's not tiptoe around the issue. Let's directly look at the statistics. Even the most recent census have pointed to the overrepresentation of black men in the mental health system. I want to see change.
Part of the support Chris has had has got him outside, appreciating nature, appreciating life.
You know, I mean, I know there's art therapy. I've heard of that. But I've never heard of ecotherapy.
Cheaper than drugs, saving the NHS more than is spent on helping people.
Well, Cecile, we heard Pamela Campbell-Morris saying that this is a particular problem in black and ethnic minority communities. You work with mental health charities. How bad is it?
First of all, I welcome the launch this week, which focus on mental health inequality and the call for parity in terms of funding of mental health service and provision alongside that of physical health problems. In terms of race and mental health, I have worked I've been previously the Vice Chair of Mental Health Trust in Derby, and I'm also a trustee of a counselling centre, Derby Counselling Centre. In terms of the BME community, there has always been a disproportionate problem in terms of accessing mental health provision, even though they show up disproportionately in the system. There may be all sorts of issues around stigma in relation to the problem, issues around diagnosis. There is a situation that those from the black community in terms of service provision are likely to be offered medication rather than the counselling, talking services. And there's also a situation that 40% of those that are diagnosed as being mentally ill are those that are in the criminal justice system, which is at odds with what we see in the indigenous white population.
Okay, well, Pamela Campbell-Morris also told us that she didn't think that politicians were doing enough on this particular issue in the black and ethnic minority communities.
Well, more money is being spent on mental health, and it's something that Jeremy Hunt has been very keen to get parity. And even the Prime Minister in Prime Minister's Questions this week welcomed the campaign to bring more focus onto mental health, and I think we have to.
But is it easy to ignore the communities that we've been hearing about?
No, I don't think we should be ignoring them. I think we should be doing something about them, and what we need to do is do more in the criminal justice system, because we do need to provide more counselling, more help within that, because I do think it is disproportionate for black and ethnic minorities in that system, and we need police officers to be trained in recognising mental health.
But earlier, though, isn't it? This is what this is all about. Getting in earlier.
It should be before, and part of that is education, because many people in the criminal justice system haven't had such good education. They've slipped through the net. We've got to stop them slipping through the net and helping them earlier.
Done, Cecile?
I don't think enough is being done, and of course, while one welcomes the push towards allocating more funding towards this, but you need to ask the question whether the health professionals are fit for purpose, whether they understand the cultural issues, whether in fact, as Pauline has just outlined, whether there is education there on the ground to raise awareness, and how do we intervene in terms of stigma within those community with respect to being mentally ill.
Well, two charities this week said that male suicide was now at the scale of a national emergency. They say that last year 6,000 people took their own lives, and 80% of those were men. 80%.
Yeah, that's shocking.
A national emergency.
It is shocking.
It can't get any more serious than that.
No, and one of the things is many of those people probably were homeless, and we are putting more money into homeless provision, and in that there should be more mental health provision for these people who are picked up off the streets and looked after. And I think we've got to do more generally for mental health, and if there's a bigger problem in black and ethnic minorities, we should be doing that. If it is the training, we should be making sure that the training is fit for purpose to make sure black and ethnic minorities don't miss out.
What concerns me is partly the contradiction in terms of government policy. It is proposed that the government is going to cut the employment support allowance, which is made available to people who suffer mental health in 2017. So how are we going to ensure that there's greater access, greater support for people suffering from mental ill health when service provision and allowances and means by which they can function is being cut through government policy?
The government has strongly defended its record on mental health, and the Department of Health has told us it's spending £11.7 billion this year on mental health, an increase of £300 million. So the government will say that they are doing more.
But that's from a relatively low base.
So are you saying it's too little too late?
I don't think it's too little too late. As I said, I acknowledge the fact that mental health is being considered as the health inequality and an attempt to look at health inequality mental health. So I welcome that, and I welcome the funding that's been allocated. But I feel that we have a long way to go to bring it to the same level as with physical health.
And of course there's a danger, isn't it, that with more cuts to come, particularly in benefits, you'll have more people who will be reaching the end of their tether and going into mental health issues.
Well, we are also putting £1.25 billion into children's mental health care, and I think that's where we need to start at the beginning of children and try and help them before they get to the stage of an adult with mental health issues. We've all had it in our families, or we've had it ourselves, or we know somebody who's had mental health problems, and there hasn't been enough provision. It has been the Cinderella service, and we need to get better at it, and we're making a good start and by making it parity with physical ill health. And I think we've got to go down that route and try and help everybody, but particularly where they are falling behind in the black and ethnic minority areas.
Can you see a way forward for this?
Yes, I welcome that there is funding allocated to young children and young people, but I don't think we should see it as an either or. I think the resources and the support and the provision should be available at all stages of the life course. With respect to the ethnic minority community, as I've indicated, things are quite dire, and I think that there are
There's a lot of work
required.
I'm sure you both accept that. Okay. Well,